Hi, everybody. My name is Kristen Kelly, and I am here on behalf of Medela to provide you with a weekly update for pregnancy and breastfeeding related to COVID-19. I am currently the Director of Infection Prevention for one of the largest academic health centers in the Midwest. And so we're very busy right now. I have my master's in public health and epidemiology. I'm a bachelor's of science in nursing, and I am a certified in infection prevention and a fellow of Association for Professionals in Infection Control, which is another way of saying I've been doing this for quite a long time. And so they granted me a fellow status. My purpose today as a mom of 3 boys is to provide some of the latest information related to COVID-19. We know that it is really hard to keep up on the latest information related to COVID because there is so much in the news and so much is changing so quickly. And so Medela wanted to synthesize that information for you and get out a weekly podcast so that you're in the know with the latest and greatest information. And we know, especially for moms out there, you're busy right now doing some homeschooling and you don't have time to really make sense of all the information you see on a daily basis. So again, Medela is doing a great job of giving you just the information that is important to have at this time. So at the hospital, the number one question that we are getting right now is, what do I need to do to be safe? How do I keep my family safe? What do I do if I get this? And so that's important. We wanted to cover that today. So I think let's start out with that question. How do I protect myself and my family? And what do I do if I'm pregnant? So whether you are pregnant or you're a member of a family or you work in healthcare, a lot of the basic prevention tips are the same. And so that keeps it really simple. The first and the most important is always going to be washing your hands frequently. This can be with soap and water for up to 20 seconds, really making sure to do a good, thorough job with our hand washing. It's easy to miss the thumbs and in between the webs of your fingers. So taking a good time to scrub the tops and the bottoms of your hands in between your fingers and your fingertips will really ensure that you're getting all of that virus off of your hands. The soap and water will just essentially just take the virus down the drain, and it will remove any of that dangerous germ on your hands. And the other way that you can clean your hands is through the hand sanitizer, which you've seen the pictures on the news that they are all sold out at the stores. So you don't have to use hand sanitizer. It's really nice for healthcare workers because you can clean your hands on the go while you're doing other things. And for moms of busy children, you can just grab a pump of the hand sanitizer and go. But you definitely do not have to have hand sanitizer. Soap and water works just fine. But you just want to make sure that no matter what method you use, that you do a good, thorough job of cleaning your hands. It takes a little bit of effort, and we know that you all will do a great job of it. As a mom of a toddler, I know that it's hard to get your children to do a good job of cleaning their hands. So the important part with your kids is just try to make it fun, have them count or sing a silly song while they do their hand washing, just to liven it up. And you'll likely extend their time at the sink, which is very important. So why is hand washing important? If you see my hands here, and let's say I touch something that's contaminated with the virus. So let's say I go out to the store and I'm pushing the dirty cart around, and then I accidentally touch my face. What that does is you can basically bring the virus to your mouth, your nose, or your eyes. And that is one of the primary routes that this virus is getting into people. So that's how folks will get infected, is that you will touch your mouth, your nose, your eyes, or someone will cough into your face, and then the virus can get inside of your body and start to replicate. So the key there is not only just clean hands as often as you can throughout the day, before you eat, after you use the restroom, after you touch something when you go outside, but also to avoid touching your face, which is what I'm trying to do a good job of right now. It's harder to do. And we touch our faces more than we realize. So again, clean hands, trying to avoid touching your face, your nose, or your mouth. And for children, that can be difficult. So I think just frequent hand washing is really important. If you're around someone that is sick or you are not feeling well, catch your cough and sneeze into a tissue. So you can cough here, but ideally you would want to cough into a tissue. Discard that tissue right away. Try to avoid putting that in your pocket. Discard it in the trash, and then always clean your hands after you cough or sneeze. And as moms of young children that seem to do that all the time anyways, I think you're probably already into a good groove with that. So you will likely not need much training. Avoid shaking hands. You can see a lot of people doing the fist pump. Also, just avoiding hugging and kissing people while greeting. There is a theory, that can spread the germs faster in countries that do a lot of kissing and hugging, but that has not been founded by the literature, just social thought out there. Avoid close contact with people who are ill. This is the biggest thing that you can do to prevent the spread. It's said in the literature that most of this virus will spread in close quarters. And you can see with the cruise ship how that spread the virus so fast. All of these people in a small cruise ship, congested, where the virus spread pretty rapidly. And I think that the same can be said for in our homes. If someone is sick, it's easy to manage that well, and we'll cover what to do in a little bit. Avoid close contact with people who are ill. This is key for those, both in your own home or if you're around someone that is ill or working. We're really asking folks not to work while ill in the healthcare setting. That is so key right now. And so if you have someone that is sick in your home, it's easy to manage that well. We'll talk about that in a little bit. Social distancing right now is the biggest thing that we can do across the globe to prevent the spread of infection. We want to keep within 3 to 6 feet of other people. So if you do go to the store, just try to avoid being right next to the other person that's with their cart. Keep a distance. Don't go down crowded aisles. Try to minimize your number of trips to the store so that you can do that in fewer trips. So instead of going out weekly, can you go out every couple weeks or even longer? That is key. As we really begin to peak with this virus, it's going to be really important to follow social distancing, even when it gets harder to do that. So with the social distancing, what that does, and this is the analogy that I like to use, is if you are a virus and you're driving down a crowded highway going very fast and you're around a lot of people, you are potentially going to infect a lot of the other cars around you. And you're going to infect them very quickly because you're around a lot of people and you're going at a very high pace. If you are a virus that is socially distanced and you're driving down the road, you're stopping at lights frequently, and you're not around as many other cars, then we are not going to spread the virus at such a fast pace. The virus pace will slow. So what we're trying to do now is it looks like COVID-19, when uninterrupted, can infect up to 2 to 2.5 people per person. So if I'm sick with COVID during the height of the pandemic, I can infect 2 to 2.5 other people around me. But if we all socially distance and I get sick and I'm not around as many other people, then I'm not going to infect that many others. And that's the key of what we want to do with socially distancing. We want to slow the spread and pace it. This provides our healthcare with the opportunity to get prepared. It means our healthcare systems will not be overrun with sick people, and everyone will be able to get a hospital bed that needs it, and that our loved ones in our community will not get sick at such a fast pace. It will also build up the immunity in our community so that the virus also cannot spread as fast as it would uninterrupted. So the key points there are: stay home if you don't feel well. If you have a fever, cough, and difficulty breathing, seek medical attention and try to call in advance so they know that you're coming. And the hospitals are doing a good job of making sure they're isolating sick patients as fast as they can and as efficiently as they can. So if they do know that you're coming through the doors, that will help. And if in doubt, follow the directions of your local health authority. Will this hurt my unborn baby if I get infected? So this is a big question. According to the CDC at this time, there isn't a lot of evidence because the papers have not been published quite yet to determine whether the virus is transmitted from a mother to her baby during pregnancy or the potential impact that this may have on the baby. There have been a couple of small studies that have seen relatively little impact to the babies and the mothers. I think this is going to become clearer in the coming months as we're able to study enough moms and babies. But at this time, the couple published studies have shown very minimal. We also know that the reports of the age distribution of the people that are getting COVID, it's like less than 1.8% was the last study I saw for 0 to 18-year-olds. And so as a mom, this is really encouraging to me that we're just not seeing serious cases of the virus. They're not being reported. There's some thoughts that kids could be asymptomatic shedders, so they could get the virus, but it doesn't cause a lot of harm. You don't see a lot of symptoms to it, but they build immunity, which is the nice thing. But as parents of sick children, we want to just take care to make sure we clean our hands in between caring for them as best as we can, and we know sometimes that can be hard. The status on delivery room restrictions in the U.S., hospital policies are varying, and so I would refer to your local hospital or the hospital where you feel like you will be delivering. The policies are changing rapidly. So please, again, ask this of the facility that you plan to deliver to understand their visitor restrictions. Some hospitals are minimizing visitors, others are granting 1, some may grant 2. I think that the OB considerations in the hospital are really a big topic of conversation right now. I know it is at our healthcare facility with getting standard work and trying to do the best to put together policies that will both be safe for the healthcare worker and for the mom and the family that is planning to deliver soon. Do I need to stop breastfeeding if I am diagnosed with COVID-19? So at this time, UNICEF, Academy of Breastfeeding Medicine, WHO, and the CDC report that limited studies on breastfeeding women with COVID-19 and other coronavirus infections have not detected the virus in breast milk. It is not known whether mothers with COVID-19 can transmit the virus via their breast milk. Currently, the primary concern is not whether the virus can be transmitted in the breast milk, but rather whether an infected mom can transmit the virus through respiratory droplets. Precautions to avoid spreading the virus to the infant include the mother washing hands before holding her baby and wearing a face mask when in close contact with her baby. Can COVID-19 be transmitted through breast milk? It is not known whether mothers with COVID-19 can transmit at this time. So I do think that more studies will be coming out. But of course, we advocate that breast milk is best and provides a lot of immunity. And particularly if a mom does also get infected with COVID, So I'm sure that there will be a lot of studies out there on this topic in the very near future as more data is coming in by the day on this. For pumping moms, do I need to sanitize my breast parts more often? So when using a breast pump to express breast milk, wash your hands before touching any pump or bottle parts and follow the CDC recommendations for proper breast pump kit cleaning at cdc.gov/breastfeeding after each use. If you have tested positive, recommendations encourage that someone who is not sick feed the express breast milk to the infant. And we know that someone that does get sick can transmit the virus between 1 to 21 days. So know that even after you're symptomatic, you can shed the virus to a lesser degree, but it still does happen. So you want to continue to keep up a very high level of practices and processes in your home to ensure that that does not infect anyone else in your family. General updates, some questions that we received in. Can I stop social distancing? So health and government officials recommend continued efforts in the practice of social distancing to stop the spread. Similar to what we talked about, it slows the pace of the virus. It doesn't allow it to travel as fast and to infect as many people. So this is for the good of the order. Though we miss our friends and it's really hard to not see them at this time, ultimately, by socially distancing, you're doing your part to keep your friends, your community, and our whole nation well. So that is super important. We recommend 3 to 6 feet and limiting large gatherings because that is where one person can infect everybody else at the party. And it won't be that much fun of a party if that happens. So what is the expectation of the duration of the pandemic? I think it really depends on how well we socially distance based off of the government models that were published this week at the presidential news conference. They showed that many of us will start to peak within a week, up to 4 weeks in this country. So I think we know a couple things. April is going to be a big month for our nation in particular, but we can do this. We can stay strong and keep isolated, and that will ultimately help us to get through this stronger, wiser, and better than if we didn't socially distance. So I know in our community, we are seeing the results of less hospital admissions since we implemented our social distancing, and we have more open beds as a result of that in the hospital. And that is the most important priority, is that if someone is sick and they do need hospital care, that they can get a bed when they need one and not have to wait. So key there. We'll provide more updates on the social distancing piece, but I think we saw some data that April is when that is going to happen for most of us across the country. And then we'll start the downward slide of fewer cases as we enter into May. From a resource perspective, Medela is doing a wonderful job of keeping all the up-to-date website resources for all the information that I've shared with you today, and we'll continue to bring updated information as it's obtained. In order to do this in the most efficient manner, we will be pulling all of your questions weekly, getting out answers to you as fast as able, and we'll be bringing these little podcasts to you weekly during the COVID crisis in our country. And we know that this is such a special time, especially for moms and babies and anyone delivering, that we want to make sure that you have all the information as well. So you feel confident at this time to bring a new beautiful baby into the world and to do that in a safe manner. So knowledge is power, and we will give you all the best information that is out there at this time. So in closing, thanks for hanging with me today. I look forward to seeing all the questions that come in from you this week. Ask away. We'll see you all next week. Stay safe and stay healthy. Bye, everybody.